various stages of human development. Each stage has its own characteristics and there are various dimensions of child development. In this video, our focus and discussion is upon the dimensions of child development. For this topic, today we have with us our expert, Dr. Sridevi. Let I introduce our respective guest and expert. Here, Dr. Sridevi did her PhD in the area of constructivist approach. After completing various master degrees, she served for 15 years in teacher education field in various institutions. Currently, she is working as an assistant professor in Department of Curriculum Studies, NCERT. She had lot of national and international publications in her credit. Welcome, Dr. Sridevi, to this video session, and myself, Dr. Elizabeth Kuruvilla. When we think of these dimensions of child development, what we want to cover in this video is concept of development, dimensions of child development, discuss the physical, emotional, cognitive, psychosocial and moral development of a child. After going through this video, you should be able to explain the concept of child development and its dimensions, discuss physical, emotional, cognitive, psychosocial and moral development of a child, understand the holistic approach of development. Okay, madam, when we start thinking about this child development, the first question what I want to ask to you is, could you please explain about what is child development? Because when we take the term development, there are different connotations coming. What do you mean by this, the term child development?
First of all, namaste to everybody. When we use the term development, what does it mean? Here, development is nothing but a process which goes on from the conception of a child to the death of a child. That means this is a continuous process which goes on throughout the lifespan. How does it happen? Like, we know that growth and development is observed in different aspects of an individual. That is why we call development as a multidimensional aspect. Now, when I say multidimensional aspect, what does it include? It means there are changes across different aspects of life. Now, what are those different aspects of life? Those different aspects are called as different dimensions of development. That's what we are going to understand in today's session. Now, a very interesting thing is, are these different aspects of life or the changes, are we going to observe them at the same time or one after the other in a sequence? Now, it's very interesting. If you observe a child in this, growing to an adult, you find that a child is growing as well as developing both physically, emotionally, socially, and other possible aspects. That means changes are happening in an individual at the same time, simultaneously. That's a very, very interesting thing. Now, what are the guiding factors, or which are the factors that cause these developmental changes? All of us have seen that lot of genetic and environmental factors are associated in bringing out these changes in the individuals. Now, in that case, like as just now I told, there are different aspects of development which we call them as dimensions of development. What are those dimensions of development? We see that an individual grows and develops physically, emotionally, psychosocially, morally, and cognitively. How does these dimensions of development are observed in an individual? Let us try to understand now.
Okay, so you have stated correctly that there are various dimensions of child development. When we think of these dimensions, generally what is coming at first in our mind is physical development. Could you please explain what type of physical changes we can observe during childhood and adolescence?
Yeah. Childhood, if we start with infancy, I think all of us know that the whole growth and development process is divided into 4 stages: infancy, childhood, adolescence, and adulthood. Now you find that when the child is born, from then till the individual becomes old, we find that there are a lot of physical changes that are happening. Now, these changes are bodily changes as well as physiological changes. That means there are internal changes as well as external changes. Now, this growth and changes, especially in general, if we look into, it happens in both body and brain. When I say body, the physical changes that appear in terms of height, weight, all these things. And then senses, our sensory organs, motor skills, whether it is fine motor skills or gross motor skills, and health and wellness of an individual. So changes will appear in all these aspects when we use the term physical development. These changes move from conception, or rather we see that these changes appear from the moment a child is conceived in the mother of a womb till the death of an individual. How does it happen? What are these changes? Let us try to understand. As I just now told you, infancy, of course, it takes, you find there is improvement physically in terms of the growth of the child. Now coming to the childhood, what type of changes do we observe? I think all of us understand that childhood is a beautiful phase where you find that there is gradual improvement in speed, steadiness of movement and accuracy in early childhood, especially 3 to 6 years of the childhood. What do you find that? You see that children grow very quickly, their height increases, their weight increases, and you even see that the body proportion, head to the remaining part of the body, you find that there is change. Now these are the changes that are explicitly, observable changes that we find in the childhood. Now the later part of the childhood, that is from 7 to 12 years, which we call as late childhood, you find that legs lengthen rapidly. That means the growth you find externally, and there is, because as a result of this, lengthening of legs, you find that there is increase in height of a child. I think all of you would have observed when you see your old childhood photographs. And another interesting factor, because of these changes, the pace of growth is more in late childhood when compared to the early childhood. So these are some of the changes that you find in, childhood. Now another interesting thing, I think
you have explained about childhood stage. As far as we are concerning about this adolescent stage, normally we will tell that there is a spurt growth rate in the case of this adolescent stage. Could you please explain that?
Yeah, I think the term which Dr. Elizabeth used, growth spurt, it's very interesting and very important aspect when we talk about adolescence. All of us know it's a beautiful phase in our human life. Now, what exactly happens? What is the reason for this growth spurt? If you observe, adolescence is a phase where the production of hormones goes to the peak. As a result of production of hormones, both boys and girls grow in a very intensive manner. And boys' growth spurt generally happens later than that of the girls' growth spurt. That is interesting.
Yes, interesting.
And another thing, there are some common changes that we observe in all adolescents. Now, first and foremost thing, you would have seen in your own self, when you were a child, your voice was different. As soon as you reach teens, your voice changes. And how is that voice change in boys and girls? We'll understand. Second thing, increase in motor performance, gross motor skills and fine motor skills improve a lot. And then there are a lot of sexual changes and secondary sexual characteristic features appear, especially because of the production of hormones. And as a result of all these changes, all these physiological changes, you find that there is increased sweating. Most of the teens, they complain, I'm sweating profusely. And they are worried about the acne which suddenly pops out on their faces. Everybody is worried. They are so, worried about their face because a lot of pimples they find on their face. And they keep trying out with various medications and so on. And not only that, even you find a big change in their, the oil secretions. Generally, oil is secreted by the skin, but at this particular point of time, oil secretions increase. As a result of that, again, acne and many other things you observe in their faces. And apart from that, all these changes also increase the appetite of the children. So children feel hungry. They want to eat a lot of snacks and other stuffs.
Yes.
Their interest towards food changes. And when you just overall, generalize, we find that there is full growth of internal systems. When I say internal system, all organ systems. And you find that their pulse rate also increases. When you compare the pulse rate of the child and an adolescent, you find that pulse rate of adolescent increases. And complete brain development is observed in adolescent. That is why you find that a lot of cognitive skills they are able to employ, or they improve with respect to cognitive development. Now, that's what I was just telling about the difference in the change of voice. Like girls have very sweet and shrill voice. Till then they would have had the similar voice. But all of a sudden you find that as they enter the teens, their voice changes. The girl's voice becomes sweet and shrill. And there are a lot of physical changes that happen in girls. Growth of breasts. And then maturity of sexual organs. You find that menstrual cycle also commences during this period because of the hormonal changes. In case of boys, again, the boys will have a broken and a deepened voice. Male, masculine voice we say.
Yes.
So the voice becomes totally deepened. It is little broken. And then another interesting thing, development of muscles. See, this is a phase where every child wants to build muscles and have a body which is very muscular in nature. That's where children want to go to gyms and practice and do a lot of exercise and so on. And another thing, as a result of these this tendency of taking care of their own physique, there is increase in muscular strength. They are capable of doing heavy works also at this particular time. So these are some of the changes, especially physical changes that we observe in adolescence.
And we can see that during this adolescent stage, generally girls will acquire this physical changes more rapidly than the boys.
Yes.
And what Dr. Sridevi has stated that the adolescent stage, the adolescents, they are very much worried about their body image. That is an important thing. Likewise, the physical development, when we look at the emotional development, we can see various mood swings happening among adolescents. Could you please explain about that?
Yeah. Very interesting it is. I feel that adolescence phase itself is the most interesting phase in our lifespan. Now, before go for adolescence, let me just try to tell you this transition of emotional development when they move from childhood to adolescence. How it is. When a child is born, at that time, he doesn't have a discrimination of different emotions, happy or sad. Then slowly, when the infant moves towards childhood, they experience feelings of love, hatred, fear, which lasts for a long time. If you would have observed children of very young age, they get scared, and even parents take advantage of that and say that if you are not doing this, he will take you away or something like that. Because fear is something which is which is commonly found in most of the children at that time.
I would like to add in this context, because when we go through the several literature, we can see that the first emotion that the infants they are having is only happiness. But hatred, fear, they are learning from the society.
Environment.
So from the environment only this type of emotions they are learning. So what we have to do in the context, school environment, we have tried to develop more positive environment at home as well as school. Okay.
Yeah, true. Congenial environment
Yes.
has to be provided, especially at home, because children are at home during that particular phase. Another interesting thing is slowly you find that children start developing or forming certain sentiments and certain complexes, especially when I use the word complex. That is again because of the environment that is provided. When one child is compared with the other child, surely inferiority or superiority complex, get into the system. So we need to take care of when the children, keeping all these points in mind. Now, another important thing, which we need to keep in mind is this is the stage where they develop a sense of autonomy, combat, doubt, and shame. These are some of the emotions that are developed in the childhood stage. Now, if they accept themselves, then they succeed in life and they become confident. If they are not able to accept themselves, or if they are not able to get the confidence, then they develop a sense of inferiority. And especially it happens when they fail in certain aspects of life. That is the reason why parents at home, neighbors, society should see that these children are given enough freedom, at the same time enough clarity in expression of emotions and so on. Now, coming to adolescence, wonderful thing what happens in adolescence is, because of the hormonal production, you find that they often, and the circumstances and the changes that are happening inside their body, which are visible, they try to have a question in their mind. Who am I?
Yes.
Whether I am a child or an adult, because parents also keep on saying, if they do something, they say that you are acting childish. If they do something, you are still a child, you are not so grown up to take decisions. So there is always a imbalance in the way the environment is providing experiences to the children.
They are experiencing identity confusion.
Crisis.
Always identity confusion is coming in their mind.
There is identity crisis also, because adolescents at that stage, they struggle for the sense of identity. They want to have an identity of themselves. And another thing is they have a self-doubting mechanism, or they question about themselves. All the time they question about their, whether they are worthy or not. So worthiness also becomes an important aspect when it comes to adolescence. Another few of the emotions or most commonly observable behavior patterns include moodiness. They are very moody. Anger. They get angry with the practices that are observed at home as well as in the society, and they are depressed because what they feel and what is observed is different, and they are anxious about various aspects, and there is always a state of dilemma when it comes to adolescence. That is why this particular stage is people comment it as an unstable stage, and it is a stage of storm and so on and so forth. It is too much romanticized in most of the literature that we read about. And one beautiful aspect which I really get fascinated is many children, most of the children, especially most of the adolescents in this particular phase, they are always in the fantasy world.
Yes.
And they have crushes with movie stars or singers, or if they are interested in physical education, they sports person, they try to imitate those people. And not only that, many times they get sexually attracted to different people, which becomes a very challenging thing for the parents to handle, how to treat them at that particular stage. So these are some of the changes that we observe in adolescence, especially with respect to emotional development.
Okay. Next one, we have to discuss about cognitive development.
Yeah.
Before going to cognitive development, could you please explain what do you mean by cognition and how cognitive development is taking place among children as well as adolescents?
Yeah. Cognition is nothing but thinking process, how we think. Now, when it comes to cognitive development, as we told that this is one of the important dimensions of development, where there are a lot of mental processes that are associated with taking in information or collecting information, organizing that information and making sense of that information. Whatever I observe, observing is collecting information, and then I organize that information and I try to make sense of that information. All these things together, we call it as cognition. And all these developmental processes are observed from infancy to adulthood. How it happens? Let us try to understand. Now, before we go to the process, let me tell you one thing, that cognitive development forms foundation for language development, social development, moral development, and emotional development. I would like to add on here. Let us remember that all these developments are interrelated with each other. Like emotional development, once they have reached the equilibrium stage, it helps in cognitive development. So all these are interrelated with each other. Now, how does a child show or demonstrate cognitive development in his childhood? All of us would have seen, when a very young child, when you give different type of objects in front of him, he'll not be able to classify them, group them initially. But slowly, he will start classifying them based on shapes first.
Yes.
He touches, feels, and then he tries to classify. And later on, slowly, gradually, he tries to classify using different other attributes like color, size, and so on. And after a few more years or few more months, you find that he also starts understanding the instructions and following them. Like if you say a child to close the door, slowly he will go and close the door. That means he starts following the instructions. And at the end of the early childhood or beginning of the later childhood, you find that children enjoy reading books. If they can't read, they expect that the parents read books for them. Teachers read books for them. At this stage, we can provide pictorial books where child really enjoy watching the pictures and listening to the stories.
Yes.
Another interesting thing, what we observe is, here he wants to talk to the peer group members. Till then, he always wanted to be with the parents. Slowly, he starts interacting with the peers and try to be in a group. That's where it's, that is the stage where peer relationship starts into the life. And slowly in later childhood, you find that they start understanding the concept of day. If you see in infancy, the child doesn't know, infant doesn't know when is night and when is day. But later childhood, the child differentiates between day and night, time, money, space. Concepts are developed in childhood. Apart from this is a phase where the child's capability of social conscience starts, or rather slowly increases, and then he tries to understand or listens to parent what is right and what is wrong. And apart from this, of course, late childhood doesn't, if you really see the characteristic feature of late childhood, you find that abstract thinking is not much, but still they want to know about future careers. That is a stage where they want to know what are the different employment opportunities, what type of professions are there, and so on and so forth. Hence, here is a time when parents and teachers have to educate these children about future careers.
Yes.
Yeah, and coming to adolescence, this is again beautiful. You will see that there is always a complaint from parents and
Yes.
teachers. Teaching adolescents is the most difficult task. They argue for everything they say.
Yes. Argumentative nature.
Yeah.
That is
See,
it.
language
Yes.
development is something in its peak. They try to talk to people, they try to argue, they try to confess. So, language skills improve a lot in, adolescence. Cognitive development doesn't mean only mental process, which is respect to remembering. It is also language development, moral development. All these things are included in cognitive development. Here is a stage where the adolescent is capable of having abstract thinking without having concrete things. He'll be able to imagine, hypothesize, and he's able to reason out. And he can do deductive reasoning, and he would like to be part of, or he loves to be part of decision making. That's the beauty of this particular phase. And another interesting feature that I think we should really feel, we should look forward is they try to distinguish between fact from the opinion, or distinguish fact from opinions. Till then, they will not have this ability. And this is the phase where every adolescent's focus is on future development. How am I going to be tomorrow or next coming years? What am I going to become? How will I look like? All these are the questions that will be there in the mind of an adolescent. So, adolescence is a phase where the individual thinks abstractly, he can reflect, he can hypothesize,
Yes.
he can critically comment and argue on various aspects. Very important thing which leads to lot of parents and teachers and societal members complain about is every adolescent asks for the proof. Yes. They are very much concerned with reasons and proofs. That's where they question religion, they question education, they question all types of institutions and their functioning. They want to have a proof for everything. So these are some of the important changes that we find in the cognitive development with respect to adolescence.
Okay, so then now we have discussed about the cognitive development, and moral development we are going to discuss in detail in another video. So now I would like to ask you about what about the psychosocial development among adolescents? Could you please explain what are the changes they are happening among the psychosocial development?
Okay. When it comes to psychosocial development, before we go for the changes, I would like to say here something that this is nothing but an interrelationship between psychological development, emotional development, and the way individuals interact with environment. That means it has psychological component, emotional component, and social component.
Yes.
That is why this dimension is called as psychosocial development. This is something which is especially regarding understanding one's own identity, selfhood, and independence. All of us know that we want to move from dependency to independence. So psychosocial development especially deals with how an individual, or talks about how an individual creates his own identity, he understands his own self and improves upon. When it comes to adolescence, as just now we have discussed, adolescents clamor for answers to questions of identity. I have already informed you that they always have a question of self-worth. So this self-worth, how are we going to develop? That's a big question which is there in front of teachers and parents and even society members. Now this can be developed or crushed because that's what is happening in the society. When there are issues that are raised by the adolescents at home or in the school, we need to resolve those issues, interacting with them, have a dialogue with them so that these issues are resolved. If they are not resolved, if they are crushed, that means the child will continue to question his self-worth. He'll doubt himself, he'll doubt his capability, and there he becomes diffident. So parents and teachers have to understand that whatever changes they are observing, both physically, cognitively and socially among the children at this particular age, are due to the hormonal changes and due to developmental aspects that they are observing. Hence, with that understanding, they should show their patience and try to interact with the children, have a dialogue with them, and try to resolve the issues then and there. Otherwise, this question of self-worth will continue till their adulthood, and the confidence of the children will never improve in that particular case.
Okay, so now we have seen what are the various dimensions of child development. So development of a child as a whole is very much essential. That is the main thing that we want to emphasize here. So thank you, Dr. Sridevi, that we have seen the dimensions of child development. Hope that the learners have understood what are the different dimensions of child development. Thank you.
Thank you.